Say hello to my little friend. Acne. We've all had it, we all hate it, and it always seems to show up at the worst time, before your wedding, before a big presentation, before your dance in the school. How do you treat it? What is it? And what makes it better and worse? And further, what are the treatments that are out there? I have the honor and pleasure of having my dear friend and colleague, Dr. Jaishree Sharad, on the channel. She is a very highly esteemed dermatologist and cosmetic dermatologist in the city of Mumbai, but has spoken all over the world, is the author of a best-selling book called Skin Rules, and has also been voted the Vogue and Elle Best Skin Expert in India. Acne. Now look, this is, I won't call it the scourge, but it's one of those things that you have with growing up, which all of us went through. I know with my wife as well as me, we both had cystic acne as teenagers. And, honestly, besides the pain and suffering, it could also be disfiguring, leaving pox and things like that. And, while I've always said that everyone is beautiful in their own way, and that the outside appearance doesn't matter, these are the sorts of things as a teenager where your adolescent hormones are already flying that make you so insecure. What is acne?
So, in very simple terms, people call them pimples or zits or blackheads, whiteheads. So it's a disorder of the pilosebaceous unit, which means the hair and the sebaceous gland or the oil gland. And by and large, it happens because of a hormonal imbalance in the body. So there's a lot of, during menarche or when puberty, when the hormones are changing, there's a lot of oil secretion. I would call it oil, we call it sebum in medical language. But there's a lot of oil secretion, and then the hair follicles get plugged with this sebum or oil, and then the normal flora, and then there's this microorganism called Cutibacterium acne, which starts multiplying. So there's a colonization of these organisms, and then that results in an inflammatory cascade. So there's a whole lot of things that happen there. So increased oil production, clogging of the pores, and then multiplication of the microorganisms, and finally inflammation.
Okay,
So
so
you
that,
have
that was a great description. So, as I understand what you're telling me, basically you've got a hair follicle and with an oil gland that kind of lubricates it. Is that the purpose of it normally?
absolutely,
And
yes.
then what happens is there's always bacteria on the skin to some degree. And what we used to call bacterium acne now has been changed to a not so cute. I know it's not so cute, but it's a cute bacterium. And then what happens is, just like everything else, stagnant water collects moss and stuff. Same thing in here, that it gets plugged because your androgenic hormones in puberty go up. You secrete a ton of oil. You're like an oil factory. You can like make a pizza with your face and dip it in flour and whatnot. And all these things, in addition to the cells in there, pile up.
In the hair follicle.
And there was a name for that, a comedone or something like that.
It's comedone, yes.
Okay.
It's called a comedone. So you have, all the blackheads are called closed or are called open comedones. And the closed ones are the whiteheads. Now, what happens a lot of times people think that blackheads are just dirt, but that's not true. It's the whiteheads which, when are exposed to air, they get oxidized, and that turns into a blackhead. So that's an open comedone. And when this gets inflamed, it turns into a pustule. So you have these pus, what people call as pimples, are these, there's an inflammatory process, and a lot of microorganism cascade that happens. And so you have these big, large pimples, and then there are cysts, which are like a group, a cluster of comedones together. So they are cysts. And then there are nodules, which are seen as bumps beneath the skin. So they're not really seen on the surface. They don't open on the surface, but they are beneath the surface. They're seen like these bumps on the skin. So these are the various varieties. And another thing is that, you can see acne not just on the face, but you also see them on the body.
So we were at What is Acne? We talked about blackheads, and now we're talking about whiteheads. Now, when they coalesce or come together, that's what happens then. And
So what happens is when you have a couple of whiteheads, which are just growing in size, they come together and they form a pimple, right? And that gets infected, and there's a lot of pus coming out, and there's pain sometimes. And when a lot of them come together, they form a cyst. So a cyst is this one large bump that you see, and you can actually see it over the surface.
wow.
And you can actually, when you feel it, we say palpate. So when you palpate it, you actually feel a little bit of fluid inside. So that's called a cyst.
So it's like an undrained abscess, basically?
It's almost like it's almost like an undrained abscess.
What's the problem with that? Why is that, why is that any worse? I'm going to ask you a follow-up question, which everyone's going to ask, where you're popping zits. Is that better for you or not? But we'll answer that in a second. What's the problem with a cyst? Why is that such a bad thing?
So what happens is when cysts heal, imagine something as large as that healing, it would heal with a scar. So imagine a balloon, it's swollen, and then you actually burst it. The entire thing goes, but then it leaves a dip, or a volcano leaves a crater.
Got it.
So similarly, here, when the cyst heals, it leaves that little dent or a scar on the face. And which is why it's very important to treat acne on time. You do not want to get into that cystic phase.
Okay, so you're talking to someone with whiteheads. So typically they come in with whiteheads, or they'll have some blackheads. Whiteheads are when it's closed and that there's pus underneath the skin, and blackheads, you said, are open to air, and so they oxidize and turn black. What do you do for that? At that point, what should someone think about doing?
I think what you should do is opt for a face wash which has beta hydroxy acid in it, which is salicylic acid. So salicylic acid is lipid soluble. It gets into the sebum, into the pore, and it unclogs the oil and the sebum, unclogs the pore for that matter. So automatically, you have a reduction in your blackheads and your whiteheads. You can also use some topical creams like 2.5% benzoyl peroxide, or you can use differin, which is a mild form of retinol, or you can even use a salicylic acid-based serum. So that also helps in reducing the blackheads and the whiteheads. So topical treatments really help. We also do a lot of proper, comedone extractions using aseptic measures. Do not try comedone extractions on your own. I've seen people buy the instrument and, try and do that. But if the instrument is not properly sterilized, and if you have not really cleansed the face well, you will end up with infection. And if you try and dig too hard, you may end up with scarring. So have it done at a clinic properly. A lot of times when you get that comedone, cleansed and get that entire sebum out, you can prevent scarring at the end of the day. So that's the beauty of getting comedone extractions done in time.
So we shouldn't be popping those whiteheads or playing with them just because they look horrible?
Not at all. And I think that's one thing that a lot of people do. And I have to admit, I've rarely got acne. I probably will get one if I apply some cream which is just not suiting me and has clogged my pores. And, I know that temptation to just pop that zit, but we shouldn't be doing it, because when you pop that zit, you are damaging deeper layers of the skin, and there is a very high chance of scarring. And secondly, you're also probably infecting the area. So you also end up with a lot of inflammation and a lot of pus, and and probably increase the number of pimples around that area. So it's a very bad thing to pop zits on your own.
So you talked about two things right there, actually three. In terms of causes, certainly teenagers with their hormones raging. Are there other categories of folks who get it?
Absolutely. A lot of times there are females and males also who are 40, 45, and they come and they say, oh my God, we never had acne in our teenage, and why is it happening now? So acne is basically because of all the hormonal changes in the body. Then, of course, teenagers get it. It can happen. It can get aggravated due to stress. So you know how the cortisol hormone will increase if you have stress, and then that will send signals to the sebaceous gland, and you have more oil production. And you know, you have a presentation tomorrow, and like, oh my God, I shouldn't get a pimple today, and bang on, you'll get one today because you've stressed so much about it. So stress is another major factor. Sometimes it is all the products that you use. So if you're using a lot of oil on your scalp and you know you sleep at night, the oil could probably trickle and you can have hairline acne. You can even have acne on your back. Sometimes it could be your creams. If you're using, you know, these days there are a lot of these essential oils, and there are a lot of creams which are really heavy, and there are water and oil emulsions. So they will clog your pores, you know, and not allow the natural process of the sebum or the oil to just come out. So clogging will again cause acne. So you've got to be very careful with the kind of creams and the products that you use. Sometimes it's your cosmetics. So, you know, females use a lot of foundation and, you know, concealers. I know guys also use it these days. And with all the Zoom and the Netflix, et cetera, found, you know, all this, the makeup that goes in can clog your pores. Some medicines. So if you are taking cortisones or even applying a cortisone cream, that can also trigger acne. That can also cause acne. If you are taking antitubercular medicines, isoniazid, you know, these kind of things can also cause acne. And finally, females, you know, they must get tested for polycystic ovarian disease, raised androgens, and insulin resistance. So all these will cause acne.
And I think, if I'm not incorrect, that even in women about a week before their menses, when their hormones are changing, they can actually get acne even after puberty. Is that correct?
Absolutely, absolutely. Because you know the progesterone levels are increasing just before the menstrual cycles, and that's when again the whole thing is about, you know, the cascade where the hormone increases, sends stimulus to the sebaceous glands, oil production, more colonization of bacteria, and so on and so forth. So,
so I think
it's amazing how, isn't it, the human body? I mean,
I think simply put, anything which plugs the pores, whether it's heavy oils or whether it's your own hormones producing them from inside or you putting them on the outside, or alternatively creams or other things, are going to lead to a stagnant pool, if you will, with bacteria in it. And that's how it all starts. Now, let me ask you something. Now you've got a social event or something, you've got that acne in, you can't pop it. I think where you're going is go to a dermatologist, get it taken care of. Now, there's a couple of different treatments for acute acne. One is what you've already described, where you take the comedone or plug out. There's another one with cystic acne. What do they do for that, where you inject it?
Yeah, so in our clinic, we have two therapies. Of course, we sometimes, you know, if the person is in a hurry and has a very important meeting, you know, the day after, a presentation to make in school or college, we probably inject a little bit of cortisone, triamcinolone, and it's really highly diluted and injected. So sometimes people are just so petrified of the word cortisone, but it really doesn't matter. If you do it the right way, you're injecting it right into the cyst. So it's not really getting into the system and you're not overdosing. So that really reduces the inflammation and reduces the size of the cyst over the next 24 hours. We also do something called carbon dioxide cryotherapy, which really helps in reducing the cystic acne and reducing the inflammation. So that's another great way of treating cystic acne. And of course, in severe cystic acne, we do give isotretinoin.
Before we go there, you've kind of built a framework that how do you, and I'll put the slide up on mild versus moderate versus severe, but if you could talk about that with mild, how do you characterize that? Is it the number of comedones or the amount of acne or the type of acne? With moderate and with severe? And then what do you do? It sounds like what you said is with mild, you're going to use topicals and things like that. Moderate, you're going to do something else. And with severe, can you tell us about that and how you?
Sure. So when it comes to mild acne, we're just talking about a couple of blackheads or whiteheads on the face, right? People actually don't know, but they're also acne. People, when people say acne, they actually talk about these large cysts. But blackheads and whiteheads are grade 1 acne. And when you have grade 1 acne or mild acne, we give you just topical creams, as I mentioned, 2.5% benzoyl peroxide, adaphyrin, or sometimes, we if you see a pustule or two, we add a clindamycin or an erythromycin gel. So that's just grade 1 acne, and taking care of your skin and eating right and cleansing at least twice a day and not applying any oil-based products. Then comes to the second variety where you have grade 2, where you have a lot of pustules. So, these bumpy yellowish things on the face. So that's grade 2, wherein we would add an antibiotic. It could be a minocycline or a tetracycline, or a doxycycline. These days, if you have a lot of acne, which are a lot of pustules there, we do limecycline. Now, there's no need to get worried about an antibiotic, having to take that for about a month or so, because these are not really antibiotics which are going to mess with the rest of your system. They're not going to act on your regular bacteria, but of course, you can't take it for too long because you could develop resistance. So we normally give it for about 1 or 2 months. That's for grade 2 acne, and we combine it. So with the same topicals that I mentioned. I may also add a clindamycin, topical clindamycin initially before starting an oral antibiotic. So then we have grade 3, where you see tiny cysts all over the face. This is where I would add a stronger topical retinoid. So probably a tretinoin, prescription-based cream. I would add azelaic acid to the clindamycin. So I would alternate between a clindamycin gel with a niacinamide, so that the niacinamide helps in hydration and prevention of blemishes. And then I would alternate it with a retinol-based cream. And there I would again add some oral medication, some antibiotics. Going further on to the severe variety, which is grade 4, where you see larger cysts and you see nodules and lumps and bumps and painful acne, I would give oral isotretinoin. So that's how we rate the acne and we treat the acne.
Now that last option has been there for years, and I remember when I was a teenager back a long time ago, that was an option. I had friends going on it, and it was a scary option because there were risks to it. In a male, it's one thing. In a female, it's a teratogen, as they say. But can you tell us a little bit about that? And I know it works like a magic bullet, but it's not something you would use until really pushed. Is that right? Or how would you classify it? And when would you use it?
So, around the whole concept of isotretinoin has changed now. When we started using it back in the day, we were using it for grossly cystic, large grade 4 acne. However, now, and back in the day, we were using really large doses, 1 milligram to 2 milligram per kilo body weight.
Wow.
And that was causing a lot of dryness, and not just on the lips and face, but all over the body. But gradually, we've now come to actually give only 0.5 milligram per kilo body weight instead of giving 1 milligram or 2 milligrams. So that reduces the side effects such as excessive dryness, etc.
And how does it work? It sounds like it just stops the sebaceous glands in their tracks. Is that about right?
Absolutely. It's just a large dose of vitamin A. It's a retinol at the end of the day, which is reducing the sebaceous gland activity.
And that means everywhere, not just in the places you want it, but that's why you get the dry mouth, the dry eyes, all the areas, right?
Yeah. Well, we start off with 10 milligrams per day. And that's fairly a very low dose. And you don't really see, these major side effects that are mentioned in the pamphlet that comes along with the drug. But one has to be very careful if one is on antidepressants. So then I wouldn't even recommend an isotretinoin or an Accutane. If you are married and even if you don't plan to conceive, I would not suggest you take isotretinoin, because if the form of contraceptive that you're using, if that doesn't work, you have to be aware that you will have to abort if you are on isotretinoin. So that is something that you have to be aware of. So normally in my practice, I give it to people who are unmarried or who have already finished with, their conception and having babies, etc. So just to be a little safer.
Yeah, that's a
Uh,
in the US, they put you on double contraception,
yeah,
and you basically say, for the period that you're on it, because it's such a, um, teratogen for a developing fetus that you really can't take the chance. But that aside, I mean, it's a tough one, but it works like magic. I
it
mean,
works like magic. But there's another thing, if you have, it can increase your lipid levels. So it's very important to, assess and get your blood parameters right before actually getting onto isotretinoin. So we do a liver profile as well as a lipid profile before actually starting the patient on isotretinoin. Sometimes when you have truncal acne, which is those large cysts on the back, we have to give, and in a person who's slightly obese, especially guys, we do give 20 to 40 milligrams of isotretinoin. In those cases, it becomes mandatory to do your lipid profile and your liver function tests and keep assessing that every month. So that's another thing that has to be kept in mind.
so that brings up a great point. At, we talked about the treatments. At what point should they be coming in to see you, a doctor, for this? And it seems to me like anything beyond mild, I would say moderate to severe, they have to have at least one visit just to kind of orient them and be evaluated. And then with the mild, they can try doing it on their own and see what happens. Maybe a video consultation would be adequate in the mild to moderate, but at the severe, there's no question in my mind that you need to be following them throughout with blood tests and all the other stuff. Is that what you're doing in your practice? Is that what you recommend?
Absolutely. I think from the time you get moderate acne, you must consult with a dermatologist because you would need some prescription drugs. And I've seen a lot of people just, buy things of their own over the counter, especially in our country. Everything's so easily available. But that's not the right thing to do. You may end up with more scarring or more infection or side effects. So always, at least one visit to a dermatologist initially if you have moderate acne. But if you have severe acne, I think you must consult with a dermatologist.
Yeah.
Now, I have to tell you that in females, a lot of times, since you brought up contraceptives, when we do give oral contraceptives, if there is a symptomatic PCOS or even PCOS, on ultrasound, or if the blood levels are haywire and they have acne, because acne is again one of the symptoms of polycystic ovarian syndrome. So that's when we do give either aldactone, or we probably give, if the androgen levels are raised, then we probably would give finasteride, and we also give oral contraceptives. So that's another thing that is, important to know.
Yeah, that's a great point. Now, we haven't talked about diets.
Yes.
Let's hit that, because you know what they would say: don't eat chocolate, don't eat donuts, don't eat all the things that kids love, because it'll give you acne. What's the truth in that, and how do you direct people?
Right. So I have, back in the day when I started practice in 2000, I would actually tell people, no, you can go ahead and eat everything and anything, because there was not adequate research back then.
Sure.
But now we have enough papers which talk about, dairy, especially skimmed milk, causing acne because it raises the IGF-1 in the body. And sugar also, for that matter, will raise your IGF-1. And so there's enough data which talks about no sugar, no dairy, and food with high glycemic index, if you can avoid that. And I've actually seen it in my practice. The people who, stop having their one glass of milk, especially skimmed milk, the skim milk that is available, there's a huge improvement in acne,
That's very interesting. And that comes at a time when I'll tell you, the vitamin D issues and lactose intolerance are kind of balanced out in the US. And even to some degree here, we don't get enough sun. No one wants to go out and get tan. And you don't want to look dark, quote unquote. But the bottom line is the kids need to get it for healthy bones. At the same time, in adolescence, it may actually be causing more acne. That's crazy. And
yes, absolutely. If you're deficient in vitamin D.
I'll ask you maybe 10 questions and you say do, don't, and then we'll give them the backup information. So let's talk about sweets. Do or don't?
Don't.
Definitely don't. How about milk? Definitely don't.
Definitely.
Okay. And what about long hair and dandruff?
Definitely no. You have to get your long hair, either tied into a pony or maybe have it cropped. So yeah, and dandruff will aggravate your hairline acne as well as your back acne. So you got to treat that with the 2% ketoconazole or something.
And washing your face 5 times a day?
That's a don't, because that is going to zap all your moisture away, and the protective lipid barrier layer is going to get damaged and you will get more acne. So maybe 2 or 3 times is enough, not 5 times.
Okay. Oily mascara or oily
No, not at all.
makeup, oil-based makeups. So water-based makeups.
Water-based is great.
Definitely. All right. And sunscreen.
Water-based or gel-based sunscreens.
Okay, great.
Yeah,
Oil
so
massages on the back.
definitely don't, because then you're going to clog the pores and have those big boils and acne on your back.
Wow. And that's a popular one in the South as well as in India in general, right?
Absolutely.
So what would you use then for your massage?
So you have these, stone massages, which are nice. You can do that, and use some water-based cream instead of an oil massage.
Okay. I've got a great one. Facials?
No.
Wow. So that, I don't know how that one will go down, but is there any facial that's safe?
I think you can do a medifacial wherein there are no massages, because the moment you massage, you're actually stimulating your oil glands, and then you'll get more acne. So medifacials are, they comprise of cleansing, microdermabrasion, a little bit of oxygen jet there and extractions, and then a mask, which is again a water-based mask. So that helps.
That could put a whole business out of order there. Right, for facials. So, we're all worried about today. And, acne is not the sort of thing that goes away overnight. You have to be very disciplined, right?
Yep. Yeah.
Tell us what your thoughts are on that.
So first of all, it's a holistic thing. So, you have to sleep on time, follow your circadian rhythm, eat well, eat healthy, make sure you have enough water, have enough greens, avoid your sugar, dairy, maida, fried potatoes, food with really high glycemic index. Do not stress. I know all of us have to deal with stress, but we have to learn to cope with it. Dr. Ram is the best. He'll tell you how to deal with stress. He's great at it. And then, of course, treat it the right way, use the right kind of things. Do not pop your zits. Do not apply toothpaste and garlic paste, because I've seen a lot of people do that.
Or turmeric is the new one, right? Haldi.
Yeah, haldi, yes. But haldi is still okay. If you mix it with
actually is a natural bacterial, from what I've understood.
It's a natural antibacterial, but no toothpaste and garlic, please. I've seen scarring and burns. And, once you start with whatever treatment you do with your dermatologist, you've got to do it in full faith, and you've got to have patience, because it is going to take a couple of months. It doesn't go away. And lastly, it can always come back if, again, if your hormones are going a little haywire, or if you use the wrong product, or if you're a lot more stressed than usual. So you have to be prepared.
Well, that was terrific. And I really appreciate you spending the time. Our view is the same, that we're here for everyone out there who is struggling to live properly and to do great things with their lives. And we're just here to help them along the road of life. So I really appreciate you joining us. And
thank you so much. Thank you for having me. It's such an honor.
My pleasure. And it was my honor. And I look forward to doing more things together and really making people live well and live longer and better lives. So take care. And remember, if you like what you're hearing, hit the like button. If you want to share it with all your friends, that would be great. And hit the subscribe button if you want to see more episodes from this channel. And hit the bell icon so that you can be alerted to the next one that we come up with. Thank you for joining us as always. It's always been a pleasure. And I look forward to seeing you again.